Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. And thank you for joining me again this week. I have another great show in store and one that I have been waiting to bring to you all for a long time. I'm here with insurance experts Joe Leigner and Jeff Thomas with USBC LLC, that's U.S. Benefit Consultants.
That's right.
And Mark Reed with the Reed Company, who's affiliated with U.S. Benefit Consultants. And today we are going to talk to you about all things we can as it relates to Obamacare and what we know, some new changes that have come about as recently as last week, and what is still very, very uncertain. So again, I say it every week, but I have a great show in store for you. So get your coffee, get your pen, get ready to take some notes, because this Obamacare frustrates me. I cannot figure it out, and I'm so happy to be here with these three experts today. So thank you all for joining me this morning. I'm so happy to have you at the station and to get this information out to our public.
Thank you
Joe,
for having us.
let's start with you. So can you just kind of give an overview of what we're going to talk about today, and then we'll start talking. I know you're going to talk about small group, and then Jeff, you're going to talk about
the individual mandate,
the impact of the individual mandate, and you're going to give us some examples. And then Mark, you're going to help.
I'll bring up large companies, 50
large
or more
companies.
employees.
Okay, so if you work for yourself, if you work for a small company, if you work for a large company, if you are on Medicare and don't, but your kids do, and you want to make sure you get the ins and outs so you can talk to your grown son and daughter who usually tells you a thing or two, stick with us, take some notes. I'm very, very interested in learning with you all today. So that being said, we're going to start off with Jeff Thomas. Again, Jeff is with U.S. Benefit Consultants with Joe, and Jeff's going to talk to you today about the individual mandate. Yes. Jeff, first of all, what is the individual mandate? What does that mean?
The Affordable Care Act required United States citizens to carry insurance starting in January of 2014. The insurance that they carry must have a minimum essential coverage level. And the Department of Health and Human Services has actually defined what those coverages are and what is basically acceptable. The coverages or the plans will be four different types of plans. They're going to be tied to a metallic level, and the metallic levels will be bronze, silver, gold, and platinum. A bronze level plan will be the least amount of benefit, and it will be tied to a 60% actuarial value. The silver plans will be tied to what is called a 70% actuarial value. The gold plan will be an 80% actuarial value, and the platinum will be a 90% actuarial value.
Okay, I have to stop you because, what you all listening today don't hear is prior to starting the show, and I told them I am absolutely the person that knows absolutely nothing. So I know my audience probably knows more than me, but what does that mean? A 60% actuarial value, a 70% actuarial value, that's terrific, but that means nothing to me.
One thing I was going to say, too, is it is so complicated. This law, just Jeff, not to interrupt you, is when they wrote it and passed it, and it was enacted on March 23rd of 2010, it was 2,700 pages at that time. And as we were all discussing this last week, Mark had mentioned there's been an additional 15,000 pages in regulations since then. It is complicated. It's onerous. It's very hard to understand, and it's...
So I'm going to try in my simplistic brain to make you all explain this in the most simplistic way possible, and we shall see. So what I'm hearing you say is, okay, it's Affordable Care Act. We know Obamacare. We know everybody is going to have insurance.
Yes.
We know that's going to cost us. Some people think that's going to be better because it's going to be less. Some people are very worried. I read an article, 70% of the United States population is worried about Obamacare. Whether that's true or not, I don't know. I don't know if that came out from a Democrat or a Republican.
2 weeks ago, they released a study. How long ago was it? That 42% of Americans don't even know it became law. So.
Yeah, so I'm so happy to have you here today. So, Back to you, Jeff.
Yes.
We're talking about affordable care for individuals who are now going to have to get insurance if they don't have it, no matter what. And they have 4 levels to choose from.
That's correct.
And you're talking about actuarial values.
Yes.
So what does that mean?
What that means is that the plans will have to cover a certain percentage of what are going to be called core benefits. And those core benefits are a list of benefits that the government has defined. They're called essential benefits. And the insurance plans will cover 60%, for example, under a bronze plan, up to a maximum out of pocket of, starting in 2014, for an individual, it's going to be $6,400 is the cost sharing piece that an individual could be responsible for.
So, holy cow, how is that affordable?
Well, it's going to be interesting to see how this all plays out. And some of those out-of-pocket maximums are higher than a lot of the policies today for individuals. So we'll just have to see how that works out. But as far as the affordable piece of it, what will be eligible, or certain individuals will be eligible for what is called a premium tax subsidy. And the premium tax subsidy is going to be something that an individual will be able to get and receive from the government. And the government will have income guidelines as to whether you're eligible for this tax subsidy. And if you're between 133 to 400% of the federal poverty line, then you will be eligible for a premium tax subsidy.
Okay. There's a lot in there, what you just said.
Yes.
Someday we'll get to you, Joe, and we'll get to you, Mark, because I'm ready to spend an hour with Jeff. But, okay, so, again, to simplify this, when you're talking, here's how I hear you. Just like we buy car insurance.
Yes.
We have to buy a minimum protection with our car insurance to meet federal standards.
Yes, and you have to do the same with the medical insurance.
Right. So we may choose to go with the minimum. However, if we choose to go higher, we're more protecting ourselves because of those unforeseen things that could happen, like an accident or, like now with healthcare, a surgery, right?
That's correct, yes.
Okay. At minimum, what I heard you say, so tell me if I'm wrong, it could be up to $6,000 cost.
That's correct.
Out-of-pocket expenses.
Out-of-pocket expenses, meaning deductibles.
For deductibles, if you don't need a surgery, no. It would be no matter what. It could be up to $6,000. Once you hit that $6,000, then they're going to pay?
Then the insurance company will come in and cover you at 100%.
Okay.
That's correct.
But the long and short of it, folks, as we're listening, I was talking to these folks before we came in. My son fell and hurt his wrist. Mm-hmm. Now, unfortunately for him, I'm in healthcare. So I said, okay, well, here's some ibuprofen. Sleep on it. We'll look at it for a few weeks. If it doesn't heal, I'll take you to the doctor. So that's what I did. 4 weeks later, he's still complaining he can't move his wrist all the way back. So I took him to the doctor at $185 because it's part of my deductible, who told me in 5 minutes he needs an x-ray. So we got an x-ray. I had to go back because they sent it to the wrist guy, who's the specialist, for another consult for 10 minutes, for another $185, that it is a scaphoid fracture. And we can't just go to surgery because it's only suspected scaphoid. Now we need an MRI. At $300 and something, got the MRI. MRI came back. Yesterday I found out he needs to go to surgery. So if you're doing the math, it's about $200 every time I see the doctor, times 3. Just to find out he needs surgery. So there's $600 plus the cost of the MRI. I've almost met the $1,200 a year deductible. And this is in a month's time for a broken wrist. It's ridiculous. Mm-hmm. And it's a lot of money.
Correct. And the $1,200 essentially that you've paid out is what counts towards that $6,400 maximum out of pocket. So what's new with the health law is that anytime you incur an expense, whether it's an office visit copayment or a copayment for a prescription drug that you pick up, that is all applied to that $6,400 out-of-pocket limit for an individual or $12,800 limit for a family.
Okay. And so what I'm saying to you all out there is, I used to think I'm in my midlife. I'm very healthy. I never really have to go to the doctor except for a couple of non-life-threatening medications. All of a sudden this year, I'm thinking I better start budgeting extra money in my annual budget for healthcare because this hurts. Coming up with $1,200 in a month is not easy. And so I'm very concerned because I don't think folks know what's coming in reality. And we've got to get people aware so that they can find where to come up with that extra couple of thousand, up to $6,000 a year. That's not easy to pull out of a household budget where people are having a hard time making ends meet already.
No, you're absolutely correct. And I know that Joe will speak later to some of the new rating methodology that's going to be employed once the law is in full effect. But we'll let him speak to that.
Okay.
Another couple of good points, though, about the law is that people will not be able to be declined for coverage starting January 1st. So in the past, they've been turned down for coverage if they may have had medical problems. Well, that's going to go away. So people with prior conditions will not be excluded from getting coverage. And
which is fabulous.
Yes,
because
absolutely.
That's not right.
That's right. And then another good point is that those same people will not be charged more for their insurance premium based off of their prior medical history.
Do you want me to talk about adjusted community rating for a second? Because I think that's a good point to sort of talk about
absolutely.
the winners and losers in that deal. In the individual and the small group market, what's going to happen is they have to operate next year under what's called adjusted community rating. What that means is rates are only going to be able to vary based on location, small age bands, and tobacco use. Let me talk about the small age bands because I think that has a lot of application out there. Whereas currently you can actually have 10 different age bands that an insurance company rates people on. Next year, the federal government's only allowing 3. 0 to 20 years old, that's not that big of a deal. 21 to 63, that's the shocker. A 21-year-old next year will pay the same rate as a 63-year-old in the individual and small group market. A lot of these young folks out there, they're going to be mandated to buy coverage next year, are going to have sticker shock when they go to purchase insurance, and the premiums have increased 400% over what they could currently purchase insurance for.
You know, and that's what I see. These young people trying to get started in life, getting married, having kids. It's great because now maternity is covered. But they're on a budget. They're on a set income. They're having a hard time making ends meet anyway. Then you add a child in there and you got to pay for all kinds of stuff that you had no idea how much this child cost. Now you got to pay for all of these healthcare expenses. I'm very, very worried about our young people just starting out, who, like every one of us, who, you know, ate ramen noodles for a little while, lived with not pretty furniture as we accumulated wealth, as we moved up the ladder in our career. And my fear is people are going to give up before they get to that level where they can breathe financially.
Hopefully. Go ahead, Mark.
Let me add one point here.
And now we're
Gene.
talking to Mark.
Yes, thank
Mark.
you. Joe's was talking about these age bands, and there's a lot of confusion on this, and I'm not sure that we're real clear exactly what that 21, 22, I guess it's 24, 25 to 63 age band.
21 to 63.
What those actual costs are going to be, but regardless, it's very different from the way the insurance companies presently price products, and so therefore it is going to have a dramatic impact on pricing.
And so again, I'm blessed every week to bring this show to you, my public, because we want to make sure that you are preparing for what is coming and not waiting for the crisis to occur. Okay, so Jeff, we keep pulling away from you.
No problem.
So individuals, it's great. Everybody's going to get covered. Pre-existing conditions are not going to hurt you anymore. Things will be covered that weren't covered before. It used to always drive me crazy. We were talking before we went on air that oftentimes you'd see prostate exams were covered, but mammograms weren't at the same rate, and it used to drive me insane. So there are definite benefits.
Yes, there are definite benefits within the law. All preventative services, preventative care procedures are all covered at 100% with no member cost sharing. So that's definitely a benefit.
And what people have to understand is this is to mandate you to get insurance. And if you choose not to, you will be taxed.
Yes, if you choose not to purchase insurance, or if you don't have insurance through an employer, you will be subject to a penalty. And the penalty is $95 in 2014 or 1% of your taxable income, whichever is greater. And for a family, it's capped out at $285. 2015, that amount goes up to $325 or 2% of taxable income, whichever is greater. And again, for a family, it's capped out at $975. And you move into the year 2016, that fine is up to $695 or 2.5% of your income, whichever is greater. And for a family, it's capped out at $2,085.
Okay. So as you're giving me these dollar amounts, because I really had no idea, I knew that there was a big hubbub around whether or not the president was going to call this a tax or not.
Right.
And so I'm a little bit aware. But as you're reading these numbers, if I put myself in the shoes of a young family, husband, wife, just had a baby in my 20s, healthy. It's tough choice time. And you got to provide insurance for the baby. But at a few $100s a year versus not, I don't know. I'm thinking people may opt not
and that's
to.
a very good point. And there's still a lot of speculation out there as to will a lot of these younger people actually enroll in these plans if they're looking at, say, a $300 or $400 a month premium. They may decide, hey, it makes more sense for me to, if something happens, I'm just going to pay for it, or I'll pay that fine, at the end of the year to the government.
I suspect so. And I don't even think it's a choice. I think people don't have a choice. They don't have $400 a month.
Do you mind if I give a quick example? I mean, we do a lot of individual business through our agency. And just to give you an idea right now, if we have a 20, 21-year-old that calls in, we can really get them a policy for under $100 a month. Because of the new age rating, the adjusted community rating that we discussed, really we're being told that same policy is going to cost about $350, $400 for that individual. Jeff and I have talked about this a lot at the office. I mean, you're almost going to be in a situation.
Wait a minute. You can get them for $100 and something now.
For somebody that young.
But in the future, next
underneath
year,
the new rating,
it'll be
about $350, $400.
So you're talking a $300 increase.
Yeah. Now, here's the big thing that Jeff and I have talked about a lot is that you may have a situation where you have 20-somethings that can afford insurance today may not be able to afford it next year unless they qualify for a subsidy. They may have to forego insurance in the future, go from having insurance today, not having insurance next year because they can't afford it and paying a fine for not having it. Now, obviously, if they qualify for a subsidy, it's a totally different scenario, but we'll get into that a little bit more when we talk about the employer groups, because if you work for an employer that actually offers what's called minimum essential coverage and your cost-sharing portion is not above what the government says it can be, you don't qualify for a subsidy. So subsidies are only available to people who either don't have a job or B, work for a company that doesn't offer minimum essential coverage and requires you to pay too much.
Okay, so you get a subsidy if you don't have a job. But if you don't have a job, you can't afford the insurance even with the subsidy.
That's a good point, Gene.
That's great. I'm getting more and more concerned as we're talking. And I suspect there's going to be a whole heck of a lot of young people that don't get insurance next year. And that scares you. Because if something happens, they're going to end up in the healthcare system and someone's going to end up paying for it. So that's just going to increase costs the future year, right? I don't know. That's just an assumption on my part. But this is very concerning to me. Okay. So, Jeff, let's continue to talk about these individual, and then we're going to move on to Joe for small group.
Okay.
How do you know if you're going to meet criteria for a tax subsidy?
Well, there will be calculators that are available and that you can use. I did run a couple of examples if you'd like me to run through those today.
That'd be great.
Okay. I ran one based off of a 32-year-old individual making an annual income of $36,000. They would be at 313% of the poverty level. The calculator ran it and said the unsubsidized health insurance premium in 2013 would be $3,570. The amount that person would pay in premium, an annual premium, would be $3,420, which equaled 9.5% of their household income and covered 96% of the overall premium. According to the calculator that I used, this person would be eligible for a premium tax subsidy of $150.
For the year.
For the year.
You're really going to have to be towards the low end of the poverty scale, 133, maybe to 200% to really get the big subsidies. Once you start getting up towards the 400%, I mean, it really phases out.
Yeah, the family that's making just a little bit above the poverty line,
400% of the poverty.
Yeah, above 400% above the poverty line is really going to get hit hard, I believe, because they're not going to be eligible for any of these premium tax subsidies.
Okay, let me just back up a minute,
Yes.
okay, because I'm going to try to keep this simple. If $36,000 a year is 313% of the poverty level, what is that 400% dollar amount?
For a family of four, it's right around $90,000.
For an individual, it's about 45.
Yeah, for an individual, it's around $45,000.
So if you're an individual at the top end,
Yes.
because after that, if you make more than $45,000 as an individual, you don't qualify for a
get
subsidy.
no subsidy.
Period. So, I work in healthcare. So if you're a nurse, don't even count on a subsidy.
Mm-hmm.
And that's scary because that's not a lot of
Right.
money.
And so you may drive a lot of those people out of the marketplace. They may have insurance today, but once this all kicks in, they may not be able to afford insurance starting in 2014.
Okay, so let's just use this as an example, okay? You have a nurse who makes maybe in the 50s, okay? And then they're married to someone who makes, well, let's just say that the husband and wife make
$60,000.
$90,000 a year.
Okay.
So they're at 400%, they qualify for a subsidy, right?
It would phase out.
Very small subsidy because they're right at the top end of that.
So it would be less than the $150 the 313% person making $36,000 a year got. So let's just assume they even got $50, right? But at that cost, you're talking about $6,000 a year, let's just say.
No, I think they'd actually be looking at a premium probably of around $1,000 a month.
Well, okay, but we were talking about bronze, silver, gold, platinum. So if you choose a plan, and let's just say you choose the one maximum out-of-pocket expenses is $6,000, right?
$6,400.
Okay, so $6,400. If you're making $90,000 a year, you and your husband, you and your wife,
Yes.
you might qualify for a $50 subsidy of
Correct.
that $6,000 mandatory. Do I have that right or no?
No. You've confused the maximum out of pocket with the amount on the subsidy and what the actual premium would be.
Oh, it's just on the premium.
Right.
Okay.
For example, let me just give you one quick one. A family of four, and I said they were making an annual salary of around $65,000. The unsubsidized premium is about $11,500 a year for a family of four. They would pay $5,723 in premium.
Okay.
So that's what, $500-$600 a month that they're going to pay in premium.
Holy cow.
Because then they would be eligible for a premium tax subsidy of around $5,800 a year. Now you move that up to about a $90,000 income, and that subsidy is going to be dramatically reduced. So much so to the point that they would probably be responsible for the entire $11,500 premium on an annual basis.
Two things to just add on that, because I think you said we're going to have to break here soon, is the IRS came out and said in 2016 they think the average cost for a bronze level plan for a family is going to be $20,000 a year. And then also something scary about the subsidies, which just got released on Friday night, is the Obama administration has decided they can't figure a way to track it this year. They're literally going to do it on the honor system next year. So
we think
Okay.
that's
Like
going
a
to open
wild,
up
wild
for a lot of
west.
fraud and abuse.
Okay, so next year is Harry Carey until we get a little bit more regulated and figure a little bit more of this out. But the long and short of this is, folks, if you're hearing what these folks are saying, Mark and Jeff and Joe, honestly, healthcare is going to cost more than you're supposed to budget for your house.
that's true.
$20,000 a year, you just now, that's a mortgage payment almost for a lot
sure
of
is.
folks or more.
Yeah, if you're a family.
So you've really got to get prepared for what's coming, folks. It's called affordable care. I can't afford it, and I'm pretty fortunate to have a very good job. So I want to just shout out some contact info because we're running out of time, and we do have to get to a quick break. But again, Joe and Jeff are with U.S. Benefit Consultants, and Mark Reed is with the Reed Company, who is affiliated with U.S. Benefit Consultants. You can get all kinds of information and details if you go to their website at www.usbenefitconsultants.com, or you can email them at info@us-bc.com. And there's also an 800 number you can call, 888-985-1013. All we've gotten to talk about so far is the individual mandate. And we've touched upon a lot of different things, and we haven't even gotten to the bottom of so many questions still. But if you do have questions, if you want to research, if you want to learn more, please go to that website, email Joe, Jeff, or Mark, or call the 800 number, 888-985-1013. We have to take a quick break, but when we come back, we're going to talk about small groups, small companies, large companies, what their share is going to be, and how it may help you or not help you if you work for a small or large company plan. We'll be right back. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. I'm back. Thanks for staying with me. This is Jean Pete. And again, just to remind you, I'm talking with Joe Leigner, Jeff Thomas, and Mark Reed, and they are here discussing Obamacare, the Affordable Care Act, and so far we've only gotten to the individual mandate. We still have a lot to cover. We're going to talk about small companies and large companies and how it impacts them and what their offerings are, and again, how that impacts the direct individual. But before we move on to that, I just have one more question for you, Jeff,
Yes.
regarding the individual mandate. Because there's a word that keeps getting thrown around in this 2,700-page law, now add 15,000 more
yeah.
pages, and that is exchanges. And we were kind of laughing at the break that I always think of the Dow and the NASDAQ and the S&P when I hear the word exchange. What is an exchange as it relates to Obamacare?
An exchange is going to be an online marketplace that individuals will be able to go to shop for plans and compare plans, and they'll ultimately be able to enroll for medical insurance through the exchange website. In order for an individual or a family to get a premium tax subsidy, they must enroll through the PPACA exchange. Now, they can purchase insurance with their broker, just like they always have. Brokers are going to be allowed to sell products both through the PPACA exchanges and in the traditional marketplace. But
PPACA being...
the Patient Protection Affordable Care Act.
That's
Okay.
the full name of the law.
That's the full name of the law.
So seriously, I mean, I had no idea. If you don't go online and enroll online through this marketplace, you could buy into this individually mandated insurance and then not qualify for the subsidy because you called your broker?
No. Your broker will be able to assist you with that. And as we understand it, there will also be brick and mortar sites that you can purchase products for the exchange.
Okay. And so every plan is now going to come out of these exchanges
No,
for the most part.
No, you'll have a fairly skinny down list of products or even companies that are going to be offered on the exchanges, according to what we're being told.
Really?
In the state of Georgia, as we understand it today, there's only going to be one company on the exchange, and that's Blue Cross Blue Shield.
Okay. So now we're creating monopolies and we're hurting the small businesses.
Well,
In
don't-
addition.
Well, if you don't mind me jumping in there, don't forget, you can still purchase private insurance just like you always have. It's just if you go through the exchange, whether you go through a broker to go through the exchange or whether you go directly to the exchange, is going to be the only way you're going to be able to get a subsidy. If you buy a private product, you're not going to be able to qualify for a subsidy. Jeff was talking a little bit about, I know that Humana and Aetna, this is public information, so I'll say it here, of the 50 states, they're only going to participate in 14 of the exchanges. They haven't listed which those 14 exchanges are. So you're going to have, it sounds like, have very limited choice when it actually comes to the exchanges. And we've been told in a lot of the insurance meetings that we've attended that they're going to offer much skinny down products, as Jeff said, on the exchange. Whereas, for instance, you might have a network today, if you signed up for a POS plan here in Georgia, that has 17,000 or 18,000 doctors. A product on the exchange, we're being told, is only going to have about 400 or 500 doctors to choose from. Whereas most of the major plans here in Atlanta cover all the major hospitals. These exchange products are probably going to have 2 or 3 hospitals to choose from. So people that do go on these plans are going to have much reduced choice from what you're accustomed to.
Okay, so folks, what I'm hearing, and everybody has a right to their own decision, but what I'm hearing is, you know what? The government can keep their $150 subsidy because I'm being completely limited. And for folks that aren't listening today, they're not aware that there are other plans that are more comprehensive from other insurance companies that aren't on the exchange where they could get better health care for the same price, or I suspect maybe even lower because they're trying to compete versus the companies that got the exchange privilege.
Well, the one comment I would make on that, Jeannie, is there is so much unknown. We don't know what prices are. We're getting some guesstimates on prices. So yeah, it's going to be very interesting to see how the exchange pricing looks against the non-exchange pricing.
Yes.
The products will be very similar, both off the exchange and on the exchange. The question is going to be, What does the network look like?
Yeah,
what
but
are
Joe
the needs?
just said it's going to be probably less than the non-exchange plans.
Oh, yes. The key is going to be a comparison for those on the exchange versus off the exchange. And that's where a quality broker is going to become important, is to try to help someone guide them through this process.
One thing that carriers are really scared about participating in the exchange is what's called in the industry adverse risk selection. In other words, they're going to get bad medical claims come to them. And the reason for that is, if you think about it, if you go on the exchange, the folks that you're really going to get, unfortunately, are people that don't have insurance today. And I'm sure everybody in the room agrees we don't want to see anybody
That's
uninsured. But so you're going to have people that haven't received care maybe in years that come to this, join the exchange,
or had pre-existing conditions and couldn't get care, so they're going to be high expense clients.
100%,
which is why a lot of carriers aren't going to choose to go on
exactly
exchange.
Right.
Okay, I got it.
Just
Thank
from
you.
like an actuarial standpoint, somebody could really be left holding the bag.
So again, you could deduct.
But also remember, Gene, that option, the high risk individual, is still able to buy outside of the exchange and get the same guaranteed issue at that point in time. So
Right.
in fairness, that
Absolutely.
could be outside the exchange. It's going to be those that are looking for the subsidy, which Joe alluded to, that would be high risk, that would be in the exchange.
Yeah, but I can almost deduct that the way it is now, which makes me very grateful that they've now extended a year for this all to, and although we're open to fraud because it's not going to be regulated and it's going to be on the honor system, hopefully they'll get it right by the time they do put it into effect. What I am deducting based on our conversation is that we're going to have all kinds of commercials, ads. The government is going to want people to understand what they need to do to get this mandated insurance, and it's going to be a lot of talk about these exchanges. And people don't know that they don't have to go to the exchange to get insurance. And so I'm deducting these people that now have to get insurance and haven't had insurance will drive up the costs. And it's an assumption, but I think it's a logical assumption that these exchange offerings are going to be more expensive than the non-exchange offerings. So blessed to have you here today, and I hope you folks that are listening are listening to this as well. You all have become absolutely necessary to the general public.
Were we not before, Gene?
Well, you're about to get real busy. And I hope you
we've
do.
been real busy. All we've been doing is studying this law since March 23rd of 2010.
I truly hope people will go and seek advice before they choose a plan, because there's so many ins and outs, which is, again, why I've had you here today. Okay, so Jeff, thank you for explaining what exactly an exchange is.
And one last point on the exchanges, Gene. They are supposed to be open for business October 1st to start enrolling people, for effective date of coverage January 1st. This first year, the exchanges are going to be open all the way through March 31st. So from October 1st all the way through March 31st.
Okay.
And then after that, it'll be more of probably a traditional type open enrollment, say October through December, for coverage effective on the first of the year.
Okay.
So, can I just tag on to something Jeff said before you come to me?
No, I'm sorry.
Something that's really important to note, and this is for all employers, whether you offer insurance today or whether you don't offer insurance today, you are actually required by October 1st to get out notices telling your employees about the exchange. So literally, the federal government is using businesses as an advertisement source, for lack of a better term, to tell their employees about the exchanges. I think that's going to be a little confusing, because then it's going to be like, well, do I go to the exchange to get coverage? Do I not go to the exchange? And once again, if their employer offers a group plan and it meets the minimum essential coverage and also the cost sharing guidelines, they don't qualify to go to the exchange and get a subsidy. It's very confusing the way they've laid it out.
Okay, so that's a great segment into what we need to talk about. So let's go right into these. If you work for a small company.
Sure. Well, if you work for, let's define what a small company is. A small company is going to be from 2 up to 50 employees. 50
Full-time.
Full-time employees. 50 or more employees is going to be considered a large group. The definition of a full-time employee changes next year. It's going to be anybody that works 30 hours or more a week. So that's going to be a change in the small group market for folks that might have a 40-hour threshold today.
Now, let me ask you this, because this is one of the sticking points that I think may gain power before the law is finalized. I mean, it's finalized, but before it goes into effect. because we got a lot of companies, a lot of industries fighting that 30 an hour
The restaurant industry has really been lobbying because it's going to really decimate the way they operate their businesses.
I hope that they make some headway there, because what that's doing to small companies is, and really, we talked about this too, it's going to end up affecting the individual, because now people's hours are going to get cut because the companies can't afford to have too many full-time employees. So now for that worker that was working 32, 35, if you do two 15-hour shifts.
Well, to let Mark talk about this, because he was going to talk about large group, but a lot of large companies this year have spent their year deciding how they're going to restructure their workforce to maybe part-time. You want to speak about that for a second,
And
Mark?
part-time is now 29 hours.
Yeah, this is a very complex area. The key is that you have to, as an employer, you have to be able to document how you are tracking your employees. The law has very specific rules and regulations as to how you have to be prepared to provide that information to the Department of Labor or IRS if questioned. And but Gene, to your point, I'm not aware, and Joe or Jeff, you may be aware of something, but I'm not aware of any initiative at this point to change that 30-hour minimum requirement. I think they're very much committed to that at this point in time.
There's a lot of lobbyist groups trying to get them to change, but I think what Mark is saying is exactly correct. That's pretty. And one important thing to differentiate between a business that's defined as a small group versus one that's defined as a large group is small group is not mandated to offer coverage. So just like today, an employer can decide to offer coverage or not to offer coverage. Obviously, there's big advantages to offering coverage as a small employer so that you can attract and retain better employees. And also, that's going to be one of the considerations when they look at the cost as a small employer. Do you drop coverage and possibly run the risk of your employees looking elsewhere for a job just because they have to find somewhere that they can afford it, especially if they're over the 400% poverty line and can't afford the insurance? It was supposed to be in 2014. Mark's going to talk about this in a second, that large groups had to offer coverage or pay a penalty, but there's been some pretty big changes in that in the past
just
past
recently.
week. Yeah.
Okay, so I won't jump ahead. So back to small companies. So that's 0 to 49 employees or 0 to 50.
Right.
Okay.
50 or more is considered large group next year.
Okay. And so, but they are not mandated.
They are not mandated to offer coverage. So a small business can operate just like they do today. The things that they're going to have to be cognizant of that are going to impact them that are different is the 30-hour threshold for somebody that's now considered full-time. Also, it's going to be mandated that you can't put over a 90-day probationary period on an employee, whereas currently you can do longer than that in small group. Next year, when somebody works for you 90 days at their full-time status, you'll have to offer them coverage. And then the big whammy, which we discussed a little bit earlier, is the adjusted community rating, the new way that plans are going to be rated in the individual and small group market.
Okay, so industry-wide, how is that going to affect certain industries then?
Well, it's going to more affect companies. Like if you have a company that's predominantly made up of younger, healthy employees, your rates are going way up. Because just look at it this way, and I know people are listening on the radio.
Which again is the restaurant
You're
industry.
sort of moving towards the middle. So what's going to happen is your older, sicker groups are actually going to see a rate decrease. Your younger, healthier groups are going to see substantial rate increases. And then we can all share here. I mean, depending on the meetings we've gone to, we've heard that younger, healthier groups can see 80, 90% rate increases next year. 80, 90% rate increases. Jeff or Mark, if you guys want to add anything.
Yeah, I would comment on that in that there is a strategy to address that.
And this is Mark now.
Yeah, Mark speaking. And that strategy, Gene, is up until this point in time, there's a technique called self-insurance, whereby a company can change the way they design their health plan and take on a higher risk themselves. Well, that usually hadn't been applicable to companies unless they had a couple, 300, 400 employees or larger. But now, because the way the law is written, self-insurance could be a way all the way down to 20 employees. And it's just a way the insurance industry has structured it. Now, the reason this is important is because what it does is that now, what Joe talked about, the way the rating is done, it removes you from that pool in calculating your risk and what your costs are, and you now, for the younger, healthier groups, can provide health insurance. health questions, and therefore be rated as to who they are versus what that bigger pool would say they are. So it's even going to amplify, we think, that pricing problem, because the young, healthier groups will go to the self-insurance strategy. They now come out of the pool, it drives the rates up. So it's going to be interesting to see how that plays out as well.
Also, strategies, what insurance companies are doing in the small group market. Let's say you're one of those younger, healthier groups. This is Joe again.
Thank you.
Younger, healthier groups. We're jumping around so much.
We're done with Jeff, so now I'm only kidding.
The insurance companies have actually rolled out a strategy called early renewal. What does that mean in plain English? Let's say that you currently renew on July 1st of 2013. And this is an important note to make. You're actually not impacted by the regulations until your next renewal in 2014. So in my scenario that I'm laying out here, the company that currently renews on 7/1/2013 actually wouldn't be impacted by these new rating methodology until July 1st of 2014. Well, the insurance companies have said, let's push that off even further. They're giving these companies a chance to renew again in the same year, 12/1 of 2013. So we may do a renewal on a group for 7/1/2013 and then another one on 12/1 of 2013, which is going to allow them to push off the ramifications, which will be the longest they can push them off. Then maybe at that time they look at a self-insured strategy like Mark said. The flip side of that equation.
So we're not going to see you until February.
Exactly. The flip side of that equation is, let's say you're an older group right now that has a lot of medical conditions in it. You might really benefit to move your renewal up to 1/1 of 2014 when these new rules go into effect. You might actually lower your costs some.
But that brings me again to the restaurant industry, because you have a lot of young, healthy waiters, waitresses, staff. And so this is why they're so upset about what's in the law right now and the 30-hour full-time categorization of hours. And so the suspicion after talking to you all is that a lot of those companies are going to end up pulling out their workers for self-insured plans.
If they're under, well, the answer is yes. We think self-insurance will become a much stronger option for companies than it has been in the past.
Okay. And how does a self-insurance product stack up to other products? Because I always thought if you got your own plan, it didn't cover as comprehensive as an employer-sponsored plan.
It is actually an employer plan, and I mean, Mark can talk about this, but the company, the employer, is actually taking on more risk. They're self-insuring some of the claims that are going to come in.
Oh, they are.
That's why it normally doesn't work in a small group environment, because if you were a 20-person company, you wouldn't want to, and this is going to get too technical for people listening, a $100,000 stop loss or a $250,000 stop loss.
I see.
So they're going to develop these products with much lower back-end liability for the small group employers.
Okay.
But it's a way for younger, healthier groups to try and get better rates.
And this is all so uncertain right now.
Yes.
So this is why everything's getting pushed back.
These products are now available, and we're looking at them. And in some cases they work, and in some cases they don't work. So it just really is very dependent.
You know, one thing I want to make sure we get to Mark on large group because he's got so much to talk about. One thing I want to say on small group that
we're back to Joe.
That people don't know. You know, we've talked about these subsidies. What people aren't talking about is how are these subsidies being paid for. One thing in the group business is there's many taxes and fees that are now being added to the plans. I'm going to talk about the two most expensive ones, and I think this is going to shock people a little bit. So if you're part of a small group plan, large group plan, there's going to be what's called an insurer fee. It's an annual fee on health insurers. It's based on their share of the marketplace. So if company A had $20 billion in premiums, company B had $10 billion in premiums, company A is going to pay more of this fee. It's going to be based on their market share. It's assessed specifically to help pay for these subsidies to the people that fall between 133 to 400%. It is $8 billion in 2014 that's been added to our insurance cost, $11.3 billion in both 2015 and 2016. 13.9 in 2017, 14.3 in 2018, and then it's indexed for inflation after that.
And this
that
is going
never
to be
goes
passed
away,
through to the insurance companies.
which then gets passed to us, the
To
consumers.
the individuals. That's where I was headed.
A lot
Nothing
of the
stays with the big company.
a lot of the insurance companies are actually starting to outline it on their renewals already to just show consumers, listen, you're paying this extra fee just to help pay for this monstrosity of a law. The other big fee is called the reinsurance fee. It's supposed to be a transitional fee that only lasts 3 years. It's supposed to help stabilize the individual market. What I mean by that, you know how I was talking about adverse risk selection a little bit earlier, and how you're going to have a lot of people that are currently uninsured with a lot of pre-existing conditions flood the market? They realize it's going to cause a lot of strife for insurance companies. This fee is literally paid to help stabilize that fee. It's supposed to only last 3 years. It's $12 billion in 2014. So when you tally that with the insurer fee, that's $20 billion in new fees added to our cost. $8 billion in 2015, and then $5 billion in 2016. It's supposed to go away after that.
Well,
But my experience is once the government gets their money on your hands on your money, we'll see.
so, Mark, you got any good news for us?
We saved the best for last.
I was going to say, let me be quick because we're out of time.
No, we're not.
The,
Lucky
the,
you.
the large employer, the law applying to large employers is dealing, as Joe had indicated, for those companies that employ 50 or more employees. And very simply stated, they are required to provide a product that satisfies the law. They are required to provide a product that is considered affordable, and there's a formula for determining that. And if they don't, then they are going to be fined or taxed based upon that. And that's a very complex discussion as well.
And is that anybody that works for them or just full-timers?
Just full-time employees,
Okay.
30 plus hours. So back to your concern about the restaurant industry we were talking about. All those quote-unquote part-time people that would, when you have to do the calculation to determine what your total number of what they call full-time equivalent employees would be, those employees that are under 30 hours, you do not have to provide health and coverage to them. So, as Joe had said earlier in our conversation, it could be that a company has 300 employees, but when you take the part-time folks out, they actually have only 25 or 40, and then you have this allowance on the tax. So it ends up being a pretty interesting discussion of how do you deal with this.
So we could really see an influx in cut hours so that these large companies...
We'll see. It depends upon the industry.
Okay.
Some industries are much more focused on this than others.
Okay, we didn't get to half of what I want to get to, and we're running out of time. So for the large company, what are the top other two things you want to get out there?
Well, I would say this: as an employee of a large company, if you start looking at these exchanges and you think, hey, this could be attractive to me because of my income, I could be eligible for the subsidy, you need to know whether or not your company provides you coverage that is considered qualified. Because if it is, as Joe had indicated earlier and Jeff, then you would not be eligible for the subsidy because your employer provides you a qualified plan.
I got to tell you, I don't even care about the subsidy. I really don't. The maximum
Well, you don't
benefit,
qualify for one anyway.
I don't
so-
qualify for one. And Joe's the insurance guy for my company, so I'm out. But honestly, for maximum benefit, which is about $150, it just doesn't make any sense.
Well,
to
there's
me.
a second thing, and that is even if I wanted individual insurance, and I said, the exchange, I'm not worried about subsidy, but I want to get off my employer's plan. The second piece is if you're participating in your employer's plan and you are having your premiums paid with pre-tax dollars, you can't just leave your employer's plan and go buy your own insurance. The IRS has rules and regulations surrounding that, so you have to be very careful about that because you may want to leave, but you can't.
Okay, so we all need to be finding benefit consultants. We really do. You all are about to get very, very, very busy. So again, we've run out of time. I've got to have you folks back. We're going to
come
have
back.
to do this as the laws change and as we get more and more information and we can get deeper and deeper and deeper into these. So for those listening, I will make sure to let you know the next time we have these folks on the schedule so you can mark your calendars. It's a very important topic that affects everyone in our country right now. But again, if you wanted to get in touch with Mark, Jeff, or Joe, you can send them an email at info@us-bc.com, or you can call the 800 number at 888-985-1013. And for individual questions, ask for Jeff Thomas. For small group, ask for Joe Leigner. And for large group, ask for Mark Reed. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.